Good morning, everyone, and welcome to the final meeting of the Joint Interim Standing Committee on Health and Human Services for this interim. Madam Secretary, please proceed to call the roll.
Senator Nguyen, Senator Titus,
I am here.
Assemblywoman Brown May,
Here.
Assemblyman Gray,
Here.
Assemblyman Hibbets,
Here.
Assemblyman Nguyen, Vice Chair Orentlicker,
Here.
Chair Donyate.
And I am here. Good morning, everyone, and thank you so much for coming to our last Joint Interim Committee meeting on Health and Human Services. It is the first day of school, so we do have a few members missing, and so we're going to go ahead and just start the meeting. And then if we have to take a pause so that all of our members are here and present, then we will do that as well. There are a few remarks that I have, but I'm going to wait until after public comment before we start the work session, once we talk into the policy. And so first and foremost, I do have a few housekeeping announcements. First, I would like to remind everyone to please silence all their electronic devices, especially cell phones and laptops during the meeting. For members joining online, please go ahead and mute your microphone when you are not speaking, but you can leave your camera on. Agenda items may be taken into a different order than listed. 2 or more agenda items may be combined for consideration. And the committee's meeting materials can be found on the Nevada Legislature's website. And you can also receive electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door and leave a business card. And if you do not wish to testify, you can also sign in so there's a record of who is interested in a particular topic or event that the committee needs to contact you on later. When testifying in person today, we ask for folks to please turn on the microphones on to speak and off to listen. And with that, we will go ahead and start public comment. At this time, we'll go ahead and begin public comment, which is limited to 2 minutes per speaker. We will go ahead and take time for everyone so that way it's a fair and concise arrangement. And in addition to testifying in person, members of the public may provide public comment in various ways, including all those listed on the agenda. Since we will be having a work session today, I encourage individuals to address any item in the work session during the first public comment period to ensure that you have an opportunity to present your views. This does not preclude us from requesting clarification if the committee has questions regarding specific items on the work session document. So with that, we'll go ahead and begin public comment here in Las Vegas, and we'll ask folks in Carson City to come to the dais as well. Looks like we have folks in Carson City first, so let's go ahead and begin there.
Good morning, Chair Donyate and members of the Joint Interim Standing Committee on Health and Human Services. Thank you for the opportunity to provide public comment. This morning, my name is Vincent Guthrow. My last name is spelled G-U-T-H-R-E-A-U, and my first name is Vincent, V-I-N-S-O-N. I have the honor of serving as the Executive Director of the Nevada Association of Counties, or NACO. As you may know, NACO is a collective county voice whose members are all 17 of Nevada's counties. I'm here this morning to provide input regarding an item in the committee work session document, specifically item number 5, which is the creation of the Public Health Improvement Fund. First, on behalf of our NACO membership, we want to express our sincere thanks to Chair Donyate for his good faith engagement of the numerous stakeholders that have worked on the proposal that's before you this morning and before this committee for consideration. We are thankful and appreciative of Chair Donyate's commitment to public health and to increase investment in public health in Nevada. Additionally, NACO thanks the Chair, the Legislature, and the Governor for the passage of SB 118 in the 82nd session of the Nevada Legislature, which provided much-needed investment in public health infrastructure. We also provided this committee our full stakeholder memorandum that represents the work and effort of the collective stakeholder group, and you may hear from some of them, or you will hear from some of them this morning as well. I wanted to highlight the perspective of our members on just a few key points. At NACO, we heard 2 main priorities from our members regarding investments in public health. One, that the funding needs to be sustainable. Our members find it challenging from a community trust perspective to stand up new ongoing programs without sustainable funding to continue those newly created services. And additionally, the funding should be flexible, especially when we are addressing local community needs. The diversity of our communities is also reflected in the diversity of our public health needs. The public health needs in White Pine County probably differ from the public health needs of Lincoln County. We do look forward to addressing in future conversations, understanding that today is just about moving forward forward a conceptual solution to Nevada's needs in public health. And while nuances around legislative oversight and flexibility of the funding allocation will need to be addressed in continued discussions, NACO realizes that this is not the last discussion regarding this policy proposal, and we would support and appreciate the passage of this BDR during the work session today. We appreciate everyone's commitment to healthy communities and a healthy Nevada, and thank you again, Chair Dunyate, for your time this morning.
Thank you, Chair Dunyate. For the record, my name is Adam Plain. I am the Insurance Regulation Liaison for the Nevada Division of Insurance. I have submitted a public comment in writing, which I will not attempt to read in any time allotted, but just willing to say that for Agenda Item 5 related to the work session, specifically Proposals 2 and 7 dealing with the Silver State Health Insurance Exchange and health insurance coverage for the screening and assessment of certain disorders and disabilities, we've attempted to provide a crash course in the archaic federal provisions for defrayal or defrayment related to certain benefit mandates and state payments. Again, not going into detail here in public comment, but I will be present, so during the work session, if there are questions, I will be able to answer those. Thank you.
Good morning. Hello, for the record, I'm Dr. Chad Kingsley, Kingsley, CHAD, District Health Officer for Northern Nevada Public Health. I want to commend the committee for its forward-thinking approach to enhancing public health funding across Nevada, especially for the impact it will have on our rural communities, as outlined in Agenda Item number 5. This is a critical step towards improving health outcomes statewide and ensuring equitable access to care. Local health authorities and stakeholders have appreciated the coordination. Our notes and recommendations that were submitted for today's proposal are available upon request. As we move forward, I urge the committee to address a few key concerns regarding the recent bill proposals. While the intention to strengthen statewide public health efforts is commendable, some aspects of the bill could unintentionally hinder local health initiatives. One significant issue is the proposed composition of local boards of health. The current recommendation may undermine the local government's ability to effectively address community-specific health needs. Local boards with a unique understanding of local challenges are best positioned to respond to those issues. Any structure that limits their autonomy could be counterproductive and should be reconsidered. Additionally, the proposal emphasizes enhancing state data authority to align with federal guidelines. While this is a step in the right direction, clarifying language is essential to ensure that this state authority is appropriate to enshrine provisions for oversight and accountability of local boards. By improving state authority and financial capacity over data management while maintaining robust local involvement, we can achieve a balanced approach that ensures both state-level coordination and local financial accountability. I recommend revisiting the bill's proposals to better integrate local perspectives and appropriate funding levels for rural counties while maintaining effective accountability through data-driven outcomes overseen by the state. The balanced approach, which ensures both state-level coordination and local financial accountability, will not only enhance the overall effectiveness of public health initiatives, but also foster a more collaborative and responsive health system between the state and local authorities. Ultimately, this benefits individuals, families, tourists, and Nevada's economy. Thank you for your attention on these important matters. I look forward to continued progress and hope for a balanced approach that benefits all Nevadans. Thank you.
Good morning, Chair Dunyate, members of the committee. For the record, Cadence Matievich, representing Washoe County. Just want to express our gratitude to the committee for the opportunities that we've had during this interim to make presentations to you and provide information to you, and wanted to express our support today specifically for items 6, 11, and 12 on your agenda. And I will be here throughout the day, and I'm happy to answer any questions that you may have as you come to those items. Thank you.
Good morning, Chair Donate and members of the Joint Interim Standing Committee on Health and Human Services. Thank you for the opportunity for me to provide public comment on item number 5 of the work session document. My name is Nikki Aker, last name is spelled A-A-K-E-R, Director of Carson City Health and Human Services. First, I would like to thank all of you and the many stakeholders for the passage of SB 118 in the last legislative session. Also, thank you for the hard work that Chair Donate and those he is engaged with for the proposal before this committee today. I would like to express the importance of public health non-categorical funding, and I repeat, non-categorical funding of which this document supports. Nevada's public health departments are highly grant funded. These funds allow us to provide many different services within our community. The majority of these funds have very specific deliverables, which does not give us the flexibility to address needs identified by community health needs assessments. Nevada's health departments have been conducting community health needs assessments for many years. These assessments are a requirement of public health accreditation, of which 3 of your health departments have achieved. Counties without health departments are fortunate to have the assistance of NACO's public health coordinator, Amy Hines-Sutherland, to assist with the foundational public health services assessment, which identifies the public health needs within those counties. Some of the needs identified within these assessments cannot be addressed with grant funding received. For instance, one of the priorities of the regional county health needs assessment conducted for the Quad counties is access to basic needs. Carson City Health and Human Services does not have grants that can directly address this need. Since we received the SB 118 monies, we are able to use some of this non-categorical funding to address a portion of this need. Each county or region has different needs, so this is the reason non-categorical funding is so important for improving the public's health in Nevada. Thank you for your time.
Thank you so much. Anyone else in Carson City? Anyone here in Las Vegas?
Good morning. My name is Fermin Leguen, District Health Officer, Southern Nevada Health District. First, I want to thank you, Chairman Donate, and committee members for the opportunity to share my comments related to this session, and also congratulate you for pursuing sustainable additional funds to support public health infrastructure in Nevada. And before I go into my comments, I want to emphasize that we strongly support the approval of this BDR. We think it's very important for the future of public health in Nevada. Having said that, I want to express my concerns regarding item 5G and 5H under public health improvement and public health interoperability. If the item 5G and 5H actually are proposing the addition of 2 members to local boards of health across Nevada. We feel that this actually might have negative results across the community, because the main reason that local boards of health are created are to prioritize and also look for main issues affecting the communities and providing direction recommendations on those issues, while having state legislature appointees there actually could be at odds with the mission, duties, and commitments of those local governing boards. I also want to share my concerns regarding item 5I, which is under public health improvement and public health interoperability. And this is more about the language that is there. We believe that data interoperability is very important for public health here in Nevada and across the country, but also we consider that the cost associated with achieving that is uncertain, and trying to force this into local health authorities might actually jeopardize the implementation of other public health initiatives that are needed across the community. I also want to say that Southern Nevada Health District strongly support data exchange and management across the state. We believe that we should have a standardized data system that includes information from local health authorities, hospitals, main healthcare providers. But we also believe that the funds allocated for this initiative must be flexible instead of having categorical items there that might actually divert the attention from local health authorities on other issues that they need to address. Thank you.
Thank you so much. Anyone else here in Las Vegas? PPS, let's go virtually, please.
Thank you, Chair. If you would like to participate in public comment, please press *9 now to take your place in the queue. Caller with the last 3 digits, 015. You are unmuted and may begin.
Good morning, Chair Doñate and members of the committee. My name is Allison Jenko. My last name is spelled Genco, and I am the Director of Nevada Government Relations for Dignity Health St. Rose Dominican, calling today to express our support for proposal number 5 on the work session document related to the Public Health Improvement Fund. As a Southern Nevada public health partner, St. Rose supported Senate Bill 118 during the 2023 legislative session, and we look forward to seeing this funding become permanent to address the needs of our community. On a personal note, I previously served as Nevada's Public Health Resource Officer, where I worked closely with the local health authorities and state public health officials to develop priorities for improving Nevada's public health infrastructure. Of those priorities, sustainable and non-categorical funding for public health services was always at the top of the list. Nevada consistently ranks low for public health spending, and this proposal will not only continue to increase our ranking, but keep our communities healthy and our economy thriving. Thank you for your time this morning, and I look forward to working with you on this important measure in the 2025 session.
Good morning, Chair Doñate and members of the committee. My name is Megan Komlossy, that's Comlossy, and I'm the Director of Public Affairs and Policy for the UNR School of Public Health. I echo the gratitude of previous speakers to the Chair and committee members for recognizing the importance of increasing flexible, sustainable state funding for the public health system. It's a system that works to keep Nevadans healthy. Proposal number 5 in the work session document is in line with one of the 4 priorities outlined in the recent Silver State Health Improvement Plan, and really key to improving the health and economic well-being of the state. So on behalf of the School of Public Health, thank you for your leadership in this area. We look forward to this BDR moving forward. Thank you.
Caller with the last 3 digits, 565. Please press *6 to unmute yourself.
Good morning, Chair Doñate and members of the Health and Human Services Joint Committee. This is Sheila Bray, SHEILA BRAY, with the University of Nevada, Reno. We'd like to improve and or support proposal number 5 today, which is the Silver State Health Improvement Plan, and show our support of that, as we believe that will help to address public health throughout all the communities, therefore leading to a healthier Nevada. And as the previous speaker, Megan Komlossi with the School of Public Health mentioned, all of the positives that go along within this plan. We'd also like to commend the committee for all of your support and recognition this interim session in support of the healthcare workforce, and look forward to meeting and working with all of you ahead of this session. Thank you.
There are no further callers wishing to offer public comment at this time.
Thank you so much, BPS. We will go ahead and close public comment and move on to the next section of our agenda, which is item number 3, approval of minutes for the meeting on April 8th, 2024. Committee members, are there any questions regarding the minutes? Seeing none, at this time, I will go ahead and entertain a motion to approve the minutes of the committee meeting, on April 8th, 2024.
So moved.
We have a motion. We have a motion from Assemblywoman Brown-May and a second from Assemblyman Gray. Is that correct?
Yes, sir.
Okay. Are there any comments or discussion on the motion before we vote? All those in favor, please say aye.
Aye.
Any opposed? The motion carries. Let's moving on to agenda item number 4, consideration of regulations proposed or adopted by certain licensing boards pursuant to NRS 439B. We'll go ahead and allow Mr. Robbins to go first.
Eric Robbins, LCB Legal. So we have 8 regulations for the committee's consideration today. We have regulation from the Board of Dental Examiners of Nevada, the Board of Examiners for Long-Term Care Administrators, the Board of Medical Examiners, the Nevada State Board of Optometry, and the State Board of Health. And we should have representatives available either in person, or virtually to answer any questions.
Thank you so much, Mr. Robbins. Let's take a quick minute just for folks to catch up, and then if we have any questions, folks can answer them. So I'll give you guys 1 minute just so we can review them. Do you want to? All right, committee members, if there are any specific regulations, are there any that we would like, that we have any questions on, and then we can go one by one. Vice Chair Hornlicker.
Thank you, Chair. My question on, this is item 4H, the nursing regulation. And one of the items is to accredit a program, 80% of the graduates have to pass, which I think sounds like a good kind of requirement. I'm just curious how 80% could be 75%, 90%. So just curious about where the 80% comes from.
Okay, thank you so much. We'll come back to that. So we'll go in order for any of the questions. Are there any other regulations? Assemblyman Gray.
Yeah, number 12, please, sir. The immunity for reporting child abuse or neglect. And I don't, maybe it's just me, but I am looking at that.
Assemblyman Gray, we're on item, sorry, we're not on the work.
I'm sorry, you're right.
The regulations.
Yeah, I'm getting ahead of myself, sorry.
It's okay. Any other regulations? Senator Nguyen.
I have a question regarding Letter C, Regulation 106-24 of the Board and Examiners for Long-Term Care Administrators.
Thank you so much. And then I also have one on LCB, item number D, LCB file R117-24 Board of Medical Examiners. So let's go ahead and begin with the folks from the Board of Examiners of Long-Term Care Administrators, LCB file R106-24. Senator Nguyen, did you want to go first? Okay. There you go. Looks like folks aren't joining in Carson City. Okay. So for this regulation, I'll go ahead and go first. On section 10 of the regulation that was proposed, I'll give you guys some time to flip to it. We'll start there. What was the rationale for including requirements for citizenship or legal status? Is there a particular reason for why that language was included?
I'm sorry. For the record, Mary Wilkinson. I'm the new executive director. I've only been on the job 8 days, so I'll give it my best shot. The regulation, the reason that was put in there, and it was specific to residential facility or assisted living administrators, and what the board was finding is that people would come into Nevada, think it was very easy to start an assisted living. They'd open the property. They didn't bother to license. They could not speak any language other than their home language. Couldn't communicate with the residents that they were to care for, and the standards were very different from some of the countries that they came from, and so that's why the citizenship question was put in there.
Okay, thank you. Let me think about this really quickly. And it's going to be a little bit difficult because I know that you just started, so I apologize if my questions come a little bit too forward. Are you, by any chance, are you familiar with AB 275 from the 2019 legislative session?
No, sir.
Thank you. So AB 275 from the 2019 legislative session essentially removed similar language that has been proposed in regulations. And so I would encourage you to research that legislation that was passed and signed by the governor. I believe this regulation and this section goes against the intention of AB 275. And so I would implore you to make certain considerations and review that before the Legislative Commission approves. Certainly, I hear the concerns, but I don't know if that's the appropriate way of resolving them. And I'm happy to chat offline as to how we can tackle that, but it seems to me that that's very narrow thinking from the board members as to how you address that problem. But that's my recommendation. I don't know if anyone else has any other comments. Senator Nguyen.
For the record, Mary Wilkinson, may I ask a question? What was the bill on that? It was 2019 and what?
Correct. It was in the 2019 legislative session. It was Assembly Bill 275.
275. Thank you.
Thank you. I would just echo that. I know that you are brand new on the job, and so you are thrust into this position where you are answering questions. So feel free to phone a friend or follow up offline. I had similar concerns. We worked on that bill in 2019. It was passed and signed into law. And when you read the language of the regulation that is being proposed by your agency, it is literally the deleted language from the 2019 law that has been deleted in that law and then cut and paste into your new regulations. So I just have some concerns, obviously, about circumventing the clear intention of that statute that was meant to, in addition to this, it was meant to take away a lot of the red tape around licensing and any kind of regulatory thing, not just for your agency, but across all state agencies. And I know that that is a very important thing to all of the members, I believe, in the legislature to get rid of unnecessary regulatory red tape. So I would encourage you to look at that law and how that coincides with this regulation that's being proposed.
Thank you, Senator Nguyen. I'm having, oh,
Mary
yes,
Wilkinson
please
again.
proceed.
May I just make a quick comment? I couldn't agree more. I think the board is very, very sensitive to making certain that the licensing process is easier. There's huge commitments relative to mobility of licensing from out-of-state candidates who wish to come into Nevada, and I do know that the board has been very effective in being one of the most, most reasonable in terms of making sure applicants get their licenses as quickly as possible. In fact, we have other states that actually come to Nevada because the process is so efficient. So I'm very sensitive to what you're saying relative to the Assembly Bill 275, and I'll certainly look at that with council and with the board. And the intent was to make sure that people don't open a property and take off because they can't operate effectively. So we are looking for public safety, and that was the intent of the whole thing. So certainly we can look at that and make sure that we're not denying anyone licensure based on any discrimination. Thank you.
Thank you so much. I'm having a tough time trying to wrap around my head as to the rationale for this. Part of me feels that there are plenty of other laws that we can use to circumnavigate the situations that we're experiencing. I mean, if there are such facilities that are being stood open, it probably, it leads to different questions. Number one, are the folks that are standing them up, have they been denied employment from other means? But number two, if they're operating without a business license or a license in general, I would presume that there's already a ability to prosecute them and go after them for that way. Doesn't matter if it's someone's legal status. I mean, it's essentially, that's the easiest way that we would go after them in general. But that's with someone starting a false business, right? We already have the ability to do that. So I would implore you to go back and restart that process. I'm still a little bit confused as to how you arrived to that conclusion, but certainly I'm happy to work with you. And I would ask that you at least fix this so that before you go to the Legislative Commission, otherwise I would hate for us to restart the process, especially if there's a certain intention that you're trying to accomplish. Any other questions?
If I may.
Did you have any closing remarks? Yes.
Yeah, I just wanted to add to the concerns that are being raised. Louis Ling, I am counsel for the board. The good news is we are in the process. These regs are still able to be changed at this point, okay? We don't have a hearing on these regs until November. So we will take the input from the committee here today directly back to our board and make sure that that language gets addressed before we have our regulatory hearing in November.
Great, thank you so much. And it goes with full disclosure. I say this to all the licensing boards. I would hope that you would have, as you're encountering these situations, I would hope that you would have staff that are bilingual and can talk to the folks that you're penalizing. That way they can at least understand the full extent of the law. That's my only request for any licensing board. All right, let's go on to the next one, LCB file 117-24 from the Board of Medical Examiners. Are there folks either in Carson City or here in Las Vegas? Looks like there's in Carson City. Good morning.
Good morning, Sarah Bradley, Deputy Executive Director here on behalf of the board.
Thank you, Ms. Bradley. Quick question on section number 2. I know that there's a lot of parts, different puzzle pieces a part of this regulation. The part that caught my eye the most was regarding access to medical records on section number 2. And I know it discusses about the medium of how records are translated. Have you guys, as the Board of Medical Examiners, have you had any conversation as to what the cost should be for accessing medical records just in general? I know that oftentimes from the patient perspective, we always hear that it's sometimes can be cumbersome for folks to be able to access their medical records. And so I don't know if this is the regulation for it or if you've had that conversation, but it spot my eye when I was reviewing it. So maybe if you have any feedback on that.
Sarah Bradley, Deputy Executive Director. There have not been extensive conversations on that. This was a recommendation from a staff member, and the board approved it at the board meeting in June for us to submit it in a reg. And the intent here, I think, is to try to say, I mean, we can't obviously change anything that's in NRS Chapter 629, but our hope is that if they're providing the records electronically, the costs are minimized and they're recovering, that medium that they use. Because I think right now a lot of it is done by pages and like hard copy. So we're hoping to try to transfer to electronic and make it a little bit easier and simpler for patients.
Great, thank you so much. Any other questions from any other committee members on this one? Let's move on to the next one. Also be file R087-24 from the State Board of Nursing. And I think Vice Chair Ornlicker had a question on this one.
Thank you, Chair. Yeah, as I indicated, I'm interested in how you arrived at the 80% threshold for grad qualifying on the examination.
Good morning. Fred Umstead, General Counsel, Nevada State Board of Nursing. The shortest answer possible is it's in the other regulations. NAC 632.605 and 625 require 80% pass rate of NCLEX to get full approval of the board. And NAC 632.630 provides that if you don't have 80% pass rate, then you are examined by the board and placed on conditional approval. I would also add that 80% is the national standard. The NCLEX stands for National Council Licensure Examination. If you want to be a nurse in any state of these United States, all 50 require the same test. I believe all the provinces of Canada require that test also. So everybody's got the same test. And as the Nevada State Board of Nursing protects the public, we approve nursing programs. We put those programs on our website. And so anybody goes on our website says, oh, those are the approved programs. So that when I pay my hard-earned money to go to that nursing program, I stand a good chance of passing that NCLEX, because I'm not going to be a nurse unless I pass that NCLEX. And so we want to show that all the programs in Nevada have 80% pass rate required. And some states have programs, and they want to have their clinicals in Nevada. So they send their students to Nevada to do clinicals. And so nurses look at our website and say, well, I'm going to go to school at a program out of state, but I want to come back into Nevada to do my clinical. And so we want to show that the out-of-state programs are as good as, pass rate-wise, the programs in state. And that's why we think we're protecting the public, and that's why we chose the 80% pass rate. Happy to answer any questions.
You know, that all makes sense. So thank you, Assemblyman Ornlicker, for the record. I just worry that sometimes when you set these standards, you may make it harder for certain applicants who come from disadvantaged backgrounds to get into a profession. So is there any concern, any evidence that we might have that kind of unfortunate screening out effect, that we prevent people who ought to be able to get into the profession from getting in? Because that can happen with these kinds of standards.
Fred Umstead, again, Nursing Board. Golly gee whiz, we are sensitive to all of the above. We have a reg process. We have a workshop. We had a workshop on this very regulation on Thursday. There was some public comment about whether or not it's discriminatory and that kind of stuff. Again, the board has not had a reg hearing on this. We will certainly reduce the workshop comments to a transcript and give that to the board before they have a hearing on it. And then, of course, in all regulations, they got to come back to the Legislative Commission. So if the board has any inclination that this would be reducing anybody's ability to get into a nursing program, we would certainly take that into effect. And on the other hand, we want qualified nurses so that when you're on the gurney looking up, you say, I know you, you're a nurse, you passed NCLEX.
Thank you.
Thank you so much. Any other further questions from any of the regulations? Seeing none, we'll go ahead and close this agenda item and move on to the work session document. Seeing that we're still missing a committee member, I'm going to go ahead and take a recess and try to figure out how far they are. So please, we'll go into recess in just a short while. Welcome back, everyone. We'll go ahead and get started with our work session document coming out of recess. We do have all our committee members present, and so we'll go ahead and begin the work session documents. So, members, the work session document is posted on the committee's meeting page, and you should all have a copy as well. It contains a list of proposed recommendations relating to matters in purview of our committee. And really quickly, before I let Mr. Ashton begin, so just as a background of the documents that we're reviewing today, over the course of the interim committee that we've held over the last several months, we've had members of the public come to us with thoughts and ideas of how to improve the healthcare system in our state. I was talking to Mr. Ashton, and I believe there's 80 plus recommendations that we reviewed, in addition, of course, to the public comment periods and those that had the chance to present in front of us. And so obviously to come to this moment has been very difficult for many reasons, right? Not because there are plenty of ideas that we could have gone with. That's not to say that we encourage folks to work with our colleagues that sit on this committee if the bill that you recommended was not on this work session document. I think there's a lot of good ideas out there, but hopefully as we go through this process, we'll be able to at least make some changes on a positive note towards our healthcare system here in the state. So we're going to go one by one for the committee members. And so we'll go one BDR by the next BDR by the next BDR, and then we'll have the opportunities to have questions on each one, and then we'll take a vote on each one as well. So that way everyone has an opportunity to have questions, discussion, and comments. So with that, we'll go ahead and start first with Mr. Ashton.
Thank you, Chair Doniate. For the record, I'm Patrick Ashton, Committee Policy Analyst with the Research Division of the Legislative Council Bureau. As nonpartisan legislative staff, I can neither support nor oppose any proposal that comes before the legislature. So the work session document was prepared by the Chair and committee staff. The document's purpose is to assist the committee in determining which legislative measures and other actions it will request for consideration during the 2025 legislative session. The document contains recommendations presented during public hearings, through communication with committee members, or through correspondence submitted to the chair, committee members, or staff. The recommendations are organized so that the committee members can review them and decide whether they want to accept, reject, modify, or take no action on the recommendations. The committee may request up to 15 bill draft requests or BDRs that relate to matters within the jurisdiction of the committee. The committee may also vote to send as many letters of recommendation or support as it chooses, or include statements in the final report. Committee members are advised that LCB staff, at the direction of the chair, may coordinate with interested parties to obtain additional information for drafting purposes or for information to be included in the committee's final report after the final meeting. For the sake of time, I will also summarize some of the recommendations. And with that, Chair Doniate, we are happy to answer any questions my colleague Davis, Florence, and I before we continue with the recommendations.
Thank you so much. Let's go ahead and proceed with our first recommendation, which deals with emergency medical services. Mr. Ashton.
For the record, Patrick Ashton, Legislative Council Bureau. We will, like the chair said, with recommendation 1 regarding emergency medical services, which you can find on page 2 and 3 of the work session document. The recommendation is to request a BDR to revise Chapter 439 and 450B of NRS to authorize the District Board of Health in a county whose population is 100,000 or more, but less than 700,000, to administer emergency medical services in the same manner as a county whose population is 700,000 or more, and to authorize a person between 16 and 18 years of age to become licensed as an ambulance attendant or as an emergency medical technician. And this recommendation 1A was proposed by Mr. Cochran, President of the Nevada Fire Chiefs Association, and recommendation 1B was proposed by Chair Doniate.
Thank you so much, Mr. Ashton, and we do have folks available for any questions that may be answered. So committee members, any questions on this proposal? Assemblyman Hibbets.
Thank you, Chair. A quick clarifying question. 1B, is that statewide or only apply to county of 100,000, 700,000 as in 1A?
Thank you so much for that question. It should be statewide.
Thank you very much.
Any other questions from any other committee members? Let's go to comments. Assemblyman Gray?
Thank you, Senator Ignati. Just one recommendation is that came up during last session. Currently, students that have to do ride-alongs for their AMT program who never touch patients, from the way I understood it, have to become licensed as an ambulance attendant just to do the ride-along. I'm wondering if we can, in this proposed BDR, do away with that requirement. So, I mean, as long as they're not touching patients, they shouldn't have to be licensed for anything as far as I'm concerned. It adds more bureaucracy and paperwork to the state and the student and the school.
Thank you so much. Any other comments? When we do the motion, we'll do the motion to accept your recommendations included as part of this work session, as part of this item, and then that's when we'll go to them. We'll do the motion to do pass after, or do pass and add your recommendation. Any other comments or suggestions before we move on to the motion? Assemblyman Gray, do you want to go ahead and do the motion?
Sure, sir. I'd like to recommend that the committee drafts a BDR with regards to item 1, emergency medical services, with the aforementioned amendment. Does that work?
Works perfectly. Do we have a second? We have a second from Assemblywoman Brown May. Any discussion or comments on this proposal? Seeing none, all those in favor, please say aye for this BDR.
Aye.
Senator Titus? Good, okay. Any opposed? This bill passes. BDR passes. Let's move on to the second one, the Silver State Health Exchange, Insurance Exchange. Mr. Ashton.
Thank you, Chair Doniate. For the record, Patrick Ashton, Legislative Council Bureau. This recommendation on the Silver State Health Insurance Exchange can be found on page 2 and 3 of the work session document, and it is based on testimony related to the Section 1332 State Innovation Waiver during the committee's meeting on April 8th of this year. The recommendation is to propose legislation to require the Silver State Health Insurance Exchange, in consultation with the Commission of Insurance and the Director of DHS, to apply for a state innovation waiver under Section 1332 of the Affordable Care Act, and to specifically seek a waiver to Section 1312 F3 of the ACA to the extent it would otherwise require excluding certain Nevada residents from enrolling in qualified dental and health plans of the state's exchange section. It also requires the exchange to conduct an actual analysis for the waiver application to determine without limitation that the waiver meets certain requirements as outlined in the sub-items of 2B of the work session document. It makes an appropriation totaling $1 million from the state general fund to the exchange over the next biennium to conduct the analysis. It requires the exchange also to complete the analysis and apply for the waiver in such a manner that it can offer health insurance under the waiver starting on January 1st, 2028, and it amends subsection 2 of NRS 695A.300 by requiring the Senate Majority Leader and the Speaker of the Assembly to each appoint one additional voting member to the Board of Directors of the Exchange. Chair Doniate.
Thank you so much. Committee members, do we have any questions regarding this bill draft request? Seeing none, is there any, I'll go ahead and entertain a motion to do pass this BDR request. We have a motion from Assemblywoman Brown May. Do we have a second?
Second.
Second from Senator Nguyen. Any discussion on this item? All right, moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Any abstention? All right, this BDR has been approved, and we will move on to our next one, which is number 3, tribal healthcare. Mr. Ashton.
Thank you, Chair. For the record, Patrick Ashton, LCB. Recommendation 3 relates to tribal healthcare. In summary, it proposes the drafting of legislation to establish a Tribal Health Authority Council on all matters related to health and health care for American Indians and Alaska Natives in Nevada. Items A through C on the work session document establish the purpose, membership, and terms of the council. Item D requires the director of DHHS to request federal approval authorizing tribal health benefit coordinators to determine Medicaid eligibility of any American Indian and Alaska Native in the state. DHHS shall also collaborate with the council and tribal health clinics for any activities that will enable such coordinators to make Medicaid determinations. Item E creates an account for tribal health in the state general fund and allows the council to apply for matching federal funds and accept gifts, donations, grants, or other money sources to fulfill the council's purposes. Item F appropriates funds to the Nevada Department of Native American Affairs for a coordinator position for the council. And item G requires DHHS to collaborate with the council in developing proposals that would establish a Medicaid reinvestment program and to submit a report regarding these proposals to this committee during the next legislative interim. The recommendation was proposed by Chair Donyate and by Angie Wilson, the director of the Reno Sparks Tribal Health Center, at the committee meeting on February 16th.
Thank you, Mr. Ashton, and I just want to thank Ms. Wilson for helping draft this BDR. I know it's historic and it's obviously will be a work in progress as we continue to evolve how we work with our tribal communities. But I just want to, I can't understate my thankfulness, of course, to Ms. Wilson. So any comments or questions regarding this proposal? Seeing none, I'll go ahead and entertain a motion to do pass this BDR. We have a motion from Senator Nguyen. Do we have a second? Second from Assemblyman Nguyen. Any discussion on this proposal?
Mr. Chair.
Senator Titus.
Hi, good morning. Appreciate first allowing me to come in on Zoom since I didn't get home till 3 o'clock this morning from the wonderful Galapagos. So I'm a little bit weather worn here, but appreciate what you're doing. Appreciate this work session document and actually allowing this communication with the tribes. I think it's long overdue. And again, it doesn't mandate that the tribes do this. It just mandates that the state helps the tribes in the best way we can. So I really appreciate this BDR and definitely support it. Thank you.
Thank you so much, Senator Titus. Any other discussions on this item? Seeing none, we'll go ahead and take a vote on the motion. All those in favor, please say aye. Aye. Any opposed? Motion carries and the BDR is approved. Let's move on to item number 4, health services provided to Medicaid enrolled pupils. Mr. Ashton.
Thank you, Chair Donyate. For the record, Patrick Ashton, LCB. Recommendation 4 proposes to draft legislation related to health services provided to pupils who are enrolled in Medicaid. The work session document includes a brief overview of the pertinent Medicaid provider types and a CMS grant that was awarded to Nevada Medicaid to expand access to critical healthcare services for pupils. The recommendation requires that the DHHS director to take any action necessary that local and state educational agencies receive Medicaid reimbursement for covered school health services and to establish incentives for providers of school health services and to apply for any necessary federal authority to increase Medicaid reimbursement rates by at least 5% for school health services and at least 10% for services rendered through school-based health centers as outlined in the work session document. Item B establishes the School Health Access Resource Center in Nevada Medicaid to assist school health services providers with billing Medicaid for the services they provide. Additionally, item C and D of the recommendation makes certain appropriations to Nevada Medicaid to establish this resource center and for additional staffing. And committee members, if you have any questions, Medicaid staff is present today to offer their expertise. Thank you, Chair.
Thank you so much, Mr. Ashton. Committee members, any questions regarding this bill draft? All right, we'll go ahead and, oh yes, is that Senator Titus? Yeah.
Yes, thank you. I have some concerns about this particular regulation, as I expressed to you earlier about where this was going. I certainly think access to care is one of my key passions, but I'm concerned about this particular bill or BDR suggestion. And was really focused on whether or not it would be for some of the mental health providers that we need in schools, because certainly children's mental health is one of those things that we have also shown some great concern and know that there's not enough access. But letting you know that the way it's currently presented, I am not in total support of it. So we'll be a no on this BDR when we do get to the voting process, but possibly as it comes out and as it's written, and all of us know that these again are just high-level views, just suggestions, and as the BDR is written, we have time to work on this, support the concept of access to care for all of our kids, especially mental health, but I'm concerned about possible interference with some other issues, and so currently I won't be supporting this.
Thank you, Senator Titus. Assemblyman Gray, and then if the folks from Medicaid can come forward, and I don't know if they want to elaborate more on it, but go ahead, Mr.
Thank you, Senator. I'm sorry, I have no comments on that.
Thank you. I don't know if the folks from Medicaid wanted to provide some background on the grant and some of the work you guys have been doing.
Mr. Chair, Stacey Weeks for the record, Nevada Medicaid. We have recently received a grant from the federal government that is going to really focus our efforts on expanding access to school-based services. And I think this bill aligns nicely with that effort. It will support the continuation of the resource center that we're going to be developing and working regionally with the counties and Department of Education, other sister divisions of our department. It's a pretty big effort, and we are happy to provide a briefing or a summary to all of you afterwards if that's helpful. On the rate increases for school health services, I just wanted to note that those would go to behavioral health services as well. So any service that's covered currently, which we do currently cover a very broad array of services in schools right now, it would include behavioral health. The issue is schools are not billing us. Even those that are actually enrolled, very few are actually billing for services outside of those that would be provided and mandated under federal law for children with disabilities. And so what we're really trying to do is get schools to really leverage Medicaid. The other effort we're looking at is getting a billing vendor and an electronic health record for schools through this grant. So schools who cannot bill and cannot access or provide themselves with an electronic health record system, that they could have access to that. So we're trying our best to simplify it and try to make it easier. We're also going to be looking at our manual and redoing the entire manual, because right now it is a little complicated trying to figure out who can provide what and how much and how often. And we're just going to really hone in on schools and what they need to do to bill. So, I hope that answers your question or provides further clarity, Mr. Chair. Happy to answer any questions members might have. Thank you.
Thank you so much, Ms. Weeks. Any other comments or questions regarding this proposal? Senator Nguyen.
Thank you. I just wanted to clarify. A lot of schools are already doing this, and this would allow like some of our rural communities to be able to engage and capture this federal money, and allows them to go farther and get more money. Is that correct, Ms. Weeks?
Mr. Chair, Stacey Weeks for the record. Yes, that is correct.
So without this change, it would be very difficult for our rural communities or smaller communities and smaller schools to be able to take advantage of this Medicaid reimbursement and get this money because they don't have these elaborate like record sharing systems. Is that correct?
Mr. Chair, Stacey Weeks for the record. This bill doesn't actually fund that electronic health record. That's more of the federal grant, but this bill would be supportive in helping us roll out that grant with the Resource Center and really supporting schools and trying to make sure we understand why they're not billing. But again, and it also puts in that 5% rate increase to really support increased reimbursement for any providers in the school system of any service that we cover. But so hopefully that answers your question. Thank you.
No, it does. Thank you so much.
Thank you so much. Any other questions? Seeing none, we'll go ahead and entertain a motion for this BDR. We have a motion from Assemblywoman Brownmaid. Do we have a second?
Second.
Second from Senator Nguyen. Any discussion on this motion? Nope. All right, we'll move on to the vote. All those in favor, please say aye. Aye. Any opposition?
Nay.
Nay.
We have 3 nays from Senator Titus, Assemblyman Gray, and Assemblyman Hibbets. The motion passes for this bill draft request. Let's move on to the next one. bill draft number 5, Public Health Improvement Fund and Public Health Interoperability. Mr. Ashton.
For the record, Patrick Ashton, Legislative Council Bureau. The next recommendation 5 proposes to draft a bill related to public health, and for the sake of time, I will briefly summarize the recommendation. Item A establishes the account for public health in the State General Fund, administered by the Division of Public and Behavioral Health, in short DPBH. The account is funded with the first $30 million per biennium of the insurance premium tax collected by the Department of Taxation. The funding must be used to address the tribal, county, district, and state public health needs in Nevada. Item B sets forth the definition of a health authority for the purposes of this recommendation, and item C creates the following formula to allocate the money in the account. To each Nevada tribe, 10%, to DPPH, 5%, to each county or district board of health in Nevada, 1%, and after this initial round of allocations, the remaining funds shall be distributed to the county or district boards of health in proportion to their respective population. Item C also sets forth provisions on what happens with funds that have not been expended by a health authority by the end of a fiscal year, and allows to carry forward up to 4% of funds as a reserve in the account. Item D, E, and F require DPBH to oversee public health priorities and associated spending plans from each health authority, and require the health authorities to submit proposals of these priorities and spending plans to DPBH for review and approval. Item G and H add 2 additional members to any district board of health, who must be appointed by the Senate Majority Leader and the Speaker of the Assembly. Finally, Item I requires health authorities to establish by 2030 a framework that includes standards on public health data interoperability and data exchange. It outlines certain conditions for the framework and requires health authorities to use funding from the Public Health Improvement Fund to establish the framework for their respective jurisdiction. Thank you, Chair.
Thank you, Mr. Ashton. Committee members, any questions or discussion on this bill draft request? Seeing none, I'll go ahead and take a motion to do pass this bill draft. Someone Gray, did you have a question?
Yes, sir. I just
wanted.
wanted. Yes, sir. No, I would actually like to just take a moment to reiterate Mr. Guthrow from NACO's comments this morning. I think it's going to be very key for this to be successful. There's going to have to be identifiable, sustainable funding, and then I think almost, or maybe even more important than that, is the ability for the counties to decide, or the public health districts to decide how they want to expend those funds instead of being directed how to expend those funds. I mean, as he well pointed out, each area has specific needs that they need to be allowed to address on their own. Thank you.
Thank you so much, Assemblyman. Any other comments with this proposal? I think we were on the motion for Senator Titus.
All right, sorry, Mr. Chair, I'm going to abstain from this vote for multiple reasons. So just so when you call that, thank you.
Sounds good. Thank you so much. We're back on the motion for due pass on this bill draft request. We'll go ahead and take a motion. We have a motion from Assemblyman Nguyen and a second from Senator Nguyen. Any other discussion on this bill draft? The only comments that I had were obviously this is probably one of the complex bills that we have coming into the next legislative session, just because there's a lot of moving parts in terms of trying to figure out sustainable funding. I think that working with our fiscal staff, there are a lot of mechanics that we're going to have to change, of course, within in due time. There was discussion as to whether or not these funds, I think it goes to show, if you've been following the April meeting that we had, that there's obviously a needed accountability. I have received numerous calls, of course, of folks who are nervous, if that's the word to use, for adding members appointed by the legislature to local health boards. And so I do understand those concerns, but I think the most important part is that there's a public discourse and folks are able from the public able to participate as to how these funds have been expended. That certainly wasn't part of the process the last time we expended these funds, and obviously we need to make sure that we're providing at least a base level of funding so that no county is left behind. And so there's a lot of mechanics that we're going to be working on. I know that I received a recommendation from last week about perhaps these funds have to be approved by the local boards and in a public matter, so that there's at least some discussion of how they should be expended. But as I mentioned, this is obviously a work in progress. So I encourage folks to continue to provide recommendations and making sure that these dollars actually go to their best interests and not to the interest of the leadership of the health districts. So with that, unless if there's any other comments, we'll go ahead and take the vote. So all those in favor on this proposal, please say aye.
Aye.
Any opposed? And we have one abstention from Senator Titus, correct?
Thank you. Yes.
Yes. Okay. The motion for this bill draft request passes. Let's move on to item number 6, Medicaid reimbursement for community-based living arrangement services provided to adults with serious mental illness. Mr. Ashton.
Thank you, Chair Doniate. For the record, Patrick Ashton, LCB. Item 6 on the work session document requests the drafting of a BDR to require Nevada Medicaid to coordinate with DPBH to establish a method of reimbursement for a therapeutic group home model of care for adults with serious mental illness who are Medicaid recipients. Additionally, the Director of DHHS shall seek all necessary federal authority to provide Medicaid reimbursement for services provided in such group home models by qualified providers. Thank you, Chair.
Thank you so much. Any questions on this proposal? All right, we'll go ahead and take a motion of due pass for this bill draft request. Assemblywoman Nguyen has a motion. Do we have a second? Second from Assemblywoman Brownmay. Any discussion on this motion or on this bill draft? Seeing none, we'll go ahead to the vote. All those in favor, please say aye. Aye.
Aye.
Any opposed? Any abstentions? Motion carries. This bill draft has been approved. Let's move on to item number 7, health insurance coverage for the screening and assessment of certain disorders and disabilities. Mr. Ashton.
Thank you, Chair Doniate. For the record, Patrick Ashton, LCB. Item 7 proposes legislation to require private and public health insurers to provide coverage for persons under 18 years of age, or if enrolled in high school until the person reaches 22 years of age, for the screening and assessment of attention deficit and hyperactivity disorder, fetal alcohol spectrum disorder, intellectual disabilities, and specific learning disorders. And this recommendation was proposed by Councilman Knudsen and Ms. Wellborn, Executive Director of the Children's Advocacy Alliance of Nevada, at the committee meeting on June 10th.
Thank you so much, Mr. Ashton. And of course, for some of these bills, you'll see that Councilman Knudsen was very helpful in this process, so I just want to give him a shout out. Any questions or comments on this proposal? Assemblyman Gray.
Just a quick question. Aren't insurers required to provide full-time students coverage until age 23 if they're on their parents' policy? And if that's the case, shouldn't the age be 23 as well?
Thank you. We'll have our legal counsel review it, but I think Assemblywoman Brownmay might have a comment.
Thank you. Relative to services of students with intellectual and developmental disabilities, typically assessment happens earlier in life, right? And so this then mandates that assessment can continue through that adult age, but it's now mandatory. So oftentimes if a child is not diagnosed very early on, they miss the assessment and then don't qualify for follow-along support services that they otherwise would be qualified for. This bill just makes it clear that any child that did not receive the assessment early will have an opportunity to be fully assessed even as they age.
Well, I have a question then, Mr. Chair.
Please proceed.
So it's all good, well and good to do the assessment, but then if there's no access to the treatment or coverage on, this bill really doesn't address that, correct? This bill just covers the assessment. In other words, there's no treatment included?
Thank you. If folks from the Children's Advocacy Alliance can come forward, I think it'd be helpful to provide some context. My understanding is this was a continuation of the bill that was passed in 2015 for a different type of the storage, and this is a continuation of it. So if you can, and just press the mic, please. There you go.
Yes. Good morning, committee. My name is Tara Raines from the Children's Advocacy Alliance, for the record, TARARAINES. And yes, this bill, the spirit of it was to offer an opportunity for folks to have access to screening and assessment for these common disorders of childhood. We do recognize that it does not include a mandate for treatment. For most of our youth, this treatment is available through school settings. We would be open to a conversation about including treatment and know that that would increase the financial burden substantially. And so we felt like a substantial first step would be to make sure that folks are identified. And with that identification, we can move toward providing robust treatment options throughout the state.
Assemblywoman Broadman.
Thank you. Thank you, Chair. Thank you for the clarification. I appreciate that. I have personal experience relative to students that potentially had not received an assessment or diagnosis and then no longer qualify for services into adulthood. It's really important as we look at skills development training, vocational assessment, vocational training. Without a diagnosis, many federal programs, they would be not authorized to participate in. So I would like to commend your work relative to this continuation of the assessment until the age of 22, which is when federally students, we no longer are responsible for students as they've aged out of high school and are transitioning into other work employment opportunities. Thank you.
Senator Titus, Assemblywoman Gray, did that answer your questions?
Well, yes, I think for me, yeah, and thank you, Chair and Assemblywoman, also for the comments and for the presenter. I agree. I think just getting a handle on how big is the problem, and then maybe look forward on how we solve it and what we need as far as access and where that lies. It's really an important step. So I appreciate that. Thank you.
Thank you so much. All right. At this time, I'll go ahead and take a motion to do pass this bill draft request.
So moved.
We have a motion from Assemblywoman Nguyen and a second from Assemblywoman Gray.
Yes.
Any other discussion on this motion? All those in favor, please say aye. Aye.
Aye.
Any opposed? Any abstentions? The motion carries and this bill draft has been approved. Let's move on to item number 8, social work apprentices. Mr. Ashton.
Thank you, Chair. For the record, Patrick Ashton, LCB. Recommendation 8 proposes the drafting of a bill to establish a social work apprentice program similar to the apprentice nurse program currently available to nursing students. And I will briefly summarize the recommendation. It requires the Board of Examiners for Social Workers to promulgate regulations authorizing a social work student to perform social work functions as a social work apprentice. The conditions on these regulations have been modeled after regulations of the State Board of Nursing for apprentice nurses. The recommendation establishes the social work apprentice program in DHHS. The department shall oversee the program and make contract with any third party to administer the program and reimburse the third party for its services. The department shall also determine various aspects of the program as outlined in the work session document. Finally, the recommendation appropriates $2 million to DHHS for the next biennium to establish and administer the social work apprentice program. And this recommendation was proposed by Senator Titus. Thank you, Chair.
Thank you so much. Any questions regarding this proposal or discussion? Senator Titus,
Just a comment?
any comments? Yeah, go for it.
Thank you. Thank you. Yay, yay, yay. This is a bill, obviously, that I suggested we spoke about. So I appreciate you including it. It was just for those who didn't hear the discussion when we had the presentation with the Nevada Rural Hospital Association on the nurse apprentice program and how well it did. And so one of the things and conversations that Senator Donata and I have had many times is to make sure that we have a real opportunity to change with this particular board or this interim committee. And when we see success in one program, it's nice if we can mirror that in others. And so this was a perfect segue since it had already been discussed. So thank you for including it. I highly support this program. Thank you.
Thank you so much, Senator Titus. Any other comments before we move on to the motion? All right, let's go for a do pass on.
Good morning.
Oh,
Good morning. I'm sorry. Hi, my name is Vicki Erickson. I'm the Executive Director of the Board of Examiners for Social Workers in the state of Nevada. My last name is Erickson.
excuse me. We're not. No, we're not in the public comment period right now. I don't think there was a question that was asked, ma'am.
Thank you. I am here. I'm from the Board of Examiners for Social Workers. I'm here to answer any questions you might have, and I have a response to this. But if it's an inappropriate time, I appreciate that.
Thank you. I don't know if any question was flagged or raised, so I don't think there's a necessary response. If there is any response, I would ask for it to be done during public comment.
Thank you.
Are there any questions from any committee members or any other discussion? Seeing none, we'll go ahead and take a motion to do pass this bill draft request. I'll go ahead and take a motion at this time. We have a motion. We have a motion from Senator Titus and the second from Assemblyman Nguyen. Any other discussion or comments? All those in favor, please say aye.
Aye.
Any opposed? And motion carries. This bill draft request has been approved. Let's move on to item number 9, healthcare workforce.
Thank you, Chair. For the record, Patrick Ashton, Legislative Council Bureau. Recommendation 9, which you can find on pages 11 through 14 on the work session document, proposes to draft a bill related to healthcare workforce, and I will briefly summarize the recommendation. The first part of the recommendation establishes the State Office of Healthcare Workforce and Licensing within DPBH, DHHS, and moves to this new state office all funding, power, and responsibilities pertaining to the Graduate Medical Education Grant Program and the Advisory Council on Graduate Medical Education established in Chapter 223 of NRS. The recommendation also establishes a behavioral health board to consolidate all boards established pursuant to the NRS chapters for psychologists, marriage and family therapists, social workers, alcohol, drug, and gambling counselors, and applied behavior analysis. And I want to note that Behavioral Health Board is modeled after Utah's Behavioral Health Board. The State of Utah Code provisions establishing its board can be found in Attachment A of the work session document. The recommendation also requires DPBH to develop and execute a plan for the transitioning to the Consolidated Behavioral Health Board so that the board starts to conduct its business no later than January 1st, 2027. And finally, DPBH must develop and provide recommendations to this committee during the next interim that outline the consolidation of all other healthcare licensing boards and other professions under the State Office of Healthcare Workforce and Licensing. A list of all these licensing authorities can be found on page 13 and 14 of the work session document. Chair.
Thank you so much, Mr. Ashton. Any questions or comments on this bill draft request? Senator Titus.
Thank you, Chair, for allowing me to have a comment here. I think that there may be some anxiety out there over this particular BDR, but I think it's a good start. I think the exact wording can always be changed, but I think it needed to be done. Some clarification for this workforce. We really need to, again, that access to care, and this is a good start. So I definitely support the concept. And again, some of the words may be changed, and we may add or take off. It's not the final document, obviously, but I think it's a great step. So thank you for bringing it forward.
Thank you, Senator Titus. Any other discussion or questions on this one? Seeing none, I'll go ahead and take a motion to do pass this bill draft request. We have a motion from Senator Nguyen. Do we have a second? Second from Assemblyman Nguyen. Any other discussion on this motion? All those in favor, please say aye. Aye.
Aye.
Any opposed? Any abstentions? Motion is carried and this bill draft request has been approved. Let's move on to item number 10, priority review of healthcare license and certificate applications. Mr. Ashton.
Thank you, Chair Donyate. For the record, Patrick Ashton, LCB. Item 10 requests the drafting of a bill to require all entities that license or certify healthcare professions to develop a process to expedite the licensure or certification process by giving priority review status to the application of an applicant for license or certificate who demonstrates that he or she intends to practice in an historically underserved community. Thank you, Chair.
Thank you so much, Mr. Ashton. Any questions from the committee members or any comments?
Yeah, I'm sorry, I keep commenting, but not really.
Senator
if I might.
Titus, go for it. Please
Again,
proceed.
the goal here for those of you who might be concerned on these particular boards, but the reality is that we wanted to make sure that the ones that are coming out to the rural area, it could take months and months and months for these applicants, depending on the licensure, to get processed. And sometimes the desperations, there's no other person out there. And to bring these folks who are willing to go out to the rural areas, the top priority accessing their application is huge. So I appreciate, again, the chair bringing this forward. Thank you.
Thank you so much. Any other comments or questions? Seeing none, we'll take a motion to do pass this bill draft request. We have a motion from Senator Nguyen. Do we have a second? Second from Vice Chair Orenlicker. Any other comments or discussion? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Motion is carried, and this bill draft has been approved. Next, we will go to our child welfare bills. We have a few of them, and we're almost to the end. We'll go ahead and let Mr. Florence from Carson City start with number 11, categorical funds for adoption assistance programs. Please begin.
Thank you, Mr. Chair. For the record, I'm Davis Florence, Secondary Committee Policy Analyst with the Legislative Council Bureau. As nonpartisan legislative staff, I can either support or oppose any proposal that comes before this committee. Recommendation 11 relates to categorical grants for adoption assistance programs. It proposes to amend Chapter 432B of NRS to adjust the calculation for the amount of the grant that is allocated to a child welfare agency to also be determined by the calculated adoption savings that has been prescribed by the United States Code. Lastly, this proposal will allow any savings from an adoption assistance program to be carried forward with that child welfare agency for 2 fiscal years instead of only 1 fiscal year. Additional information relating to this proposal may be found under Attachment B of the work session document, and this was proposed by Ms. Ashley Garza Kennedy on behalf of Clark County, and Ms. Joanna Jacob should be available for any questions. Thank you, Chair.
Thank you so much, Mr. Florence. As you mentioned, this is a proposal recommended from Clark County. So if there's any questions or regarding the intention or the recommendation, then now would be the time. So any questions or discussion on this one? Seeing none, I'll go ahead and take a motion to do pass. We have a motion from Assemblyman Nguyen. Do we have a second? A second from Assemblyman Brown-May. Any other discussion on this motion? All those in favor, please say aye. Aye.
Aye.
Any opposition? Any abstention? Motion is carried, and this bill draft has been approved. Moving on to item number 12, immunity for reporting child abuse and neglect. Mr. Florence.
Thank you, Mr. Chair. Davis Florence, LCB Research for the record. Recommendation number 12 relates to immunity for reporting child abuse or neglect. It proposes the drafting of legislation to amend Chapter 432B of NRS to clarify the provisions regarding the protection from criminal and civil liability for individuals who make a good faith report of suspected or known child abuse or neglect, or who provide assistance such as medical evaluations or consultations in connection with such reports or investigations. Specifically, this recommendation proposes extended immunity for civil or criminal liability to every person who in good faith permits, takes, reviews, consults, or provides a medical opinion regarding a medical test, photographs, or x-rays. Additionally, this proposal would provide that a mandatory reporter who has prevailed as a defendant in a civil action may be awarded by the court costs and reasonable attorney's fees incurred by the defendant. Additional information for this proposal may be found under Attachment C of the work session document, and Ms. Joanna Jacob should be available for questions. Thank you, Chair.
Thank you, Mr. Florence. Assemblyman Gray, I think you had a question on this one if you want to proceed.
I did, sir. So I guess I want to clarify, is this aimed only at mandatory reporters? Because I'm looking at paragraph A, and it says to clarify the provisions regarding the protection from criminal and civil liability for individuals who make a good faith report or jumping forward and then a comma, such as or neglect who provide assistance. So I see two categories of people there, a mandatory reporter as well as somebody who's not a mandatory reporter. I don't want to see non-mandatory reporters protected under this provision. As you know, child abuse allegations are often used in divorce cases. Lots of reasons for to wage lawfare on people. To determine good faith in those cases is really hard. But I think as long as you have a licensed individual or somebody who is a mandated reporter, I think good faith should be assumed and be covered by this. So my question is it aimed at both of those or just mandatory reporters? And if it's mandatory reporters, I think we need to make that a little more clear in that first sentence.
Thank you so much, Assemblyman. So and we have Ms. Jacobs here to answer that as well. So my understanding is this is it's one of the attachments that's provided to the work session. It's to make sure that we're in alignment with the Child Abuse Prevention and Treatment Act, CAPTA. And so I'll let Ms. Jacobs provide more a response to it. But I believe it's for mandatory reporters. But you may begin.
Thank you, Chair Donate, members of the Interim Healthcare Committee, Joanna Jacob on behalf of Clark County. And Assemblyman Gray, I no longer can look at you above my head, but thank you for the opportunity to clarify that. To back up what you're saying, I just did want to put on the record that Clark County, what we're trying to get at right now is we conduct on average about 11,000 investigations on reported child abuse and neglect through to the agency. So that would address, sir, some of the concerns that you have. We respond to everything. However, what we're really trying to get at are the cases that get referred after going through that investigations for criminal prosecution. So on average, we do 11,000 investigations, but in the last year, about that 11,000, we only sent in about 1,279 reports that actually went to our DA. So this was identified through our DA and our Metro teams who work on these criminal cases. And so I just am putting out what we're trying to do. The federal law was updated in 2018, codified in 2019 to say that we should have immunity for what we're really trying to get at is the medical professionals who may be called upon to testify in that criminal case and to afford them the ability to opine on whether it is child abuse or neglect or not, importantly. So I agree with you that maybe the language that we submitted may be a little broad. Happy to narrow down the language. For example, on the last page of the language, we said if a defendant prevails in a civil action, that I agree with you, may be too broad, and we can narrow it down to, I would prefer maybe a healthcare provider if they were sued for malpractice, but they still did reported and participated in good faith. So again, you are only under the existing law afforded immunity if you participate in good faith. So that is one standard. So if you were reporting to harass, for example, you would not be covered by this. And then the second thing would be if it could be a healthcare provider, or we could talk about the narrowing that you suggested on mandated reporter. I just would have to check if they are included in that definition, Assemblyman Gray. But that's really our intent. I hope that answers the question, and happy to answer any others.
Through you, Senator Senator Donyade.
Please proceed.
I appreciate that and thank you. And Dr. Titus, correct me if I'm wrong, but I believe all healthcare providers are covered as mandatory reporters. I think one change to this that I would like to see made is that second line under A is change individuals to mandated reporters. And I think that would fix everything below that as well. Would that be an acceptable change?
Sorry about that. I'm discussing with legal real quickly. While I'm discussing with them, Senator Nguyen, if you wanted to ask your question.
This kind of goes in line with what I think Assemblyman Gray is also trying to get at. is it possible to, it sounds like this is somewhat in alignment with that federal act. Is there any way we can draft it to make it so it's specific and in alignment with that federal act? Because I think that would probably give more specificity to the drafting of the legislation that might take into consideration some of the concerns that Assemblyman Gray has as well. And I recognize that these are just recommendations that are coming out of this work session, and we'll be working on the details of the language, but do you think that might do that, if I can ask legal?
Eric Robbins, LCB Legal, for the record. Yeah, we could draft it to just refer to the federal law, probably.
Chair Donati, Joanna Jacob, for the record, that is our intent. And so for legal, I'll just give you the citation to the law, to the Child Abuse Act, Reauthorization Act of 2018. So our intent is to mirror the federal protections. I'm happy to accept that proposal, and also keep in mind the guidance from Assemblyman Gray today. We just would want to make sure that that we work on the language, and that's very good discussion today. We don't want to make it broader than what I'm stating as the intent.
Thank you, Ms. Gray. So in speaking with legal counsel and Senator Nguyen, it sounds like as a response to your proposal, would you be okay with a recommendation to instead to do pass this recommendation, but to refer back to what is already in CAPTA in federal law and make sure that it's in alignment with it? Would that solve your concerns?
I'm sorry, was that to me, Senator Giannotti?
That's correct. So
okay.
The recommendation would be to do pass this recommendation, but to align it to federal law, which is CAPTA. Does that satisfy your request?
Yeah, I mean, I'll support it one way or the other. I just, I'd like to see, all federal workers, all medical workers, law enforcement, teachers, anybody that's a mandated reporter, as long as they report in good faith, I'd like to see them covered for any litigation purposes. But if we just narrow it to healthcare workers, I'm good with that too. But I think, I think the overall intent here is to protect the kids and make sure people that should report are reporting and that they're protected. So take that for what it's worth, but I will support it going out either way.
Sounds good. Looks like we have a recommendation from Senator Nguyen. Please proceed.
I would move to accept I'd move to pass the recommendation number 12 with the amendment that it aligns with more specificity to the federal act.
And I'll second it.
Thank you. So we have a motion from Senator Nguyen and a seconded from Assemblyman Gray. Any questions or discussion? All those in favor, please say aye. Aye.
Aye.
Any opposition? Any abstentions? Motion is carried and this bill draft has been approved. Let's move on to item number 13, adoption of children and adults. Mr. Florence.
Thank you, Mr. Chair. Davis Florence, LCB Research, for the record. Recommendation number 13 relates to the adoption of children and adults. It proposes the drafting of legislation to do the following. Item A codifies Nevada Administrative Code 127.140 into Chapter 127 of NRS to authorize the fingerprinting of an applicant for an initial license as a director of a private child placing agency. Item B authorizes the Division of Child and Family Services to release information to relatives under extenuating circumstances as determined by the division. And item C authorizes prospective adoptive parents to attend a court hearing by video conference or any other technological means available to the court. And this recommendation was proposed by Ms. McDade Williams, the administrator from DCFS, and is available for questions. Thank you, Chair.
Thank you so much. Committee members, are there any questions or discussion on this bill draft request? Assemblywoman Brown-May.
Thank you, Chair. I just wanted to offer my commendation for the hard work on this. As a person that was adopted as an infant, locating siblings has been really important to completing a family and having the ability for a child to be able to make that determination outside of the consent given to their parent, I think is really important, that we allow families to reunify whenever possible when they desire to do so. So for me, this is an important step forward for our kids that have come through foster parents or adoptive situations to be able to relocate their siblings. I just want to say thank you for the folks that are working on this bill, and I look forward to working on it throughout session.
Thank you so much, Assemblywoman Brown May. This was a cleanup BDR recommended from Ms. McDade-Williams. I just want to thank her as well. Any other comments or questions on this proposal? Assemblywoman Gray.
Yes, thank you, Senator. Just want to echo Assemblywoman Brown May's comments and say especially that item B is long overdue. Yeah, there's people out there that want answers to their lives, and it's time they get them. And with that, I would also like to offer a motion to do pass.
Thank you so much. We have a motion from Assemblyman Gray. Do we have a second from Assemblywoman Brown May? Any discussion on this motion? All those in favor, please say aye.
Aye.
Any opposed? Motion's carried. And I just want to clarify for the record, I know Dr. Titus had a slight glitch on her computer, but she was a yes on item number 12 as well. So I just want to make sure that we were clear with that. Let's move on to item number 14, the Office of Children's Mental and Behavioral Health. Mr. Florence.
Thank you, Mr. Chair. Davis Florence, LCB Research for the record. Recommendation 14 requests the drafting of legislation to create the Office of Children's Mental and Behavioral Health within the Director's Office of DHHS. Item C of this proposal outlines the duties of the Director of the Office of Children's Mental and Behavioral Health. And item E makes an appropriation to the office for the personnel and operating costs during the 2025-2027 biennium. And this recommendation was proposed by Councilman Knutson and Director Wellborn. Thank you, Chair.
Thank you so much. And we do have folks available to answer any questions regarding this proposal. So any questions from committee members at this time? Any comments? Assemblywoman Brown May.
Thank you, Chair. I think it's really important that we just go on record this morning, or that I personally go on record this morning to say how important this is and how loudly we heard the voices throughout this interim talk about children's mental health and how we really have to pay attention to it. So I think this Office of Children's Behavioral Health is really important as we continue to look forward. How do we raise healthy citizens for our future and investing in our children now to help us identify where we can get better? And so I want to personally thank this committee for supporting this measure and really as we invest in our children throughout the next legislative session.
Thank you so much, Assemblywoman. Any other comments or questions? Seeing none, I'll go ahead and take a motion to do pass. Do we have a motion? We have a motion from Assemblywoman Brown May and a second from Assemblyman Nguyen. All those in favor, please say aye. Aye. Any opposition? Any abstentions? Motion's carried. Moving on to item number 15, statement on cardiovascular health. Mr. Florence.
Thank you, Mr. Chair. Davis Florence, LCB Research for the record. So that concluded our recommendations for legislation that were included in the committee's work session document. As Mr. Ashton mentioned earlier, the committee may vote to send as many letters of recommendation or support as it chooses, or it may include statements in the final report. With that, the final recommendation that is included in the work session document proposes to include a statement of support in the committee's final report that supports an updated complete streets policy as developed through the context-sensitive design approach from Nevada's Department of Transportation. And this recommendation was proposed by Chair Doñate in response to testimony provided by representatives of NDOT at the joint meeting of Growth and Infrastructure and HHS in July. Thank you, Chair.
Thank you so much, Mr. Florence. This was a recommendation based on the meeting that we had with our colleagues on the Growth and Infrastructure Interim Committee. Essentially, it just says we love complete streets and folks being active to prevent cardiovascular disease. So that's pretty much it. Any questions or suggestions? All right, we'll go ahead and take a motion to do pass. We have a motion from Senator Nguyen. Do we have a second? seconded from Assemblyman Nguyen. Any discussion on this letter? All those in favor, please say aye. Aye.
Aye.
Any abstentions or opposition? Seeing none, this letter has been approved. Give me 1 second. We've reached the end of the work session document, so now we'll go to public comment, and then I'll let, since this is our last meeting, I'll let committee members if they have any comments after as well. So we'll go ahead and go to public comment. So if folks have any public comment, I would ask to please come forward. We will allocate 2 minutes per person, so if you can please state your name. And so we'll go ahead and start here in Las Vegas or in Clark or in Carson City. Seeing none here in Las Vegas, let's go to Carson City. Please begin.
Good morning. My name is Vicki Erickson. I'm the Executive Director of the Board of Social Work. I want to apologize for earlier in my disruption. I'm still getting my legislation feet wet, so I apologize. Thank you for letting me speak. I wanted to speak on behalf of the social work apprentices. Just for consideration, I wanted to let you know that the University of Nevada, Reno and University of Las Vegas do have practicums for bachelor level and master level students, which consist of 450 hours per semester. Moving forward, after they receive their master's degree, if a social worker wants to move on to clinical licensure, they do obtain 3,000 hours of internship, very similar to that of an apprenticeship. It would be helpful with the funds, just for some consideration, to consider allowing some of those funds to go to the university to pay for some of the practicum students. But the Social Work Board is happy to continue to work with the legislative committees throughout the legislative session. And I want to thank you, Dr. Titus and Senator Danyade, for bringing this forward. I appreciate it. Thank you very much.
Thank you so much, ma'am. Any other public comment either in Carson City or in Las Vegas at this time? BPS, is there anyone virtually?
Thank you, Chair. If you would like to participate in public comment, please press star 9 to take your place in the queue.
Good morning. This is, for the record, this is Valerie Haskin, VALERIEHASKIN. I serve as the Rural Regional Behavioral Health Coordinator, and as such, I serve the Rural Regional Behavioral Health Policy Board. My public comment today probably echoes some of the things that you've heard previously. The item that I would like to provide public comment on is item number 8 from the work session document regarding the social work apprenticeship. While it is wonderful and badly needed that we get more hands-on training for social workers, particularly out in our rural communities and those who may be working in a healthcare environment, unfortunately, it is unknown yet at this time, from what I understand, as to whether or not this may affect the Board of Social Work's ability to enter into its interstate compact, which is something that our board is working with them on. Interstate compacts allow for a much cleaner process to get experienced and licensed providers into the state of Nevada. And so this would provide so having the apprenticeship program, while it would be great to have all that additional training, we need to make sure that it does not affect the ability of the social work board to enter into the interstate compact. Thank you very much for your time, and we appreciate the consideration.
Ms. Wilson, please proceed. Angie Wilson, please proceed. There are no callers wishing to offer further public comment at this time.
Thank you so much. If Ms. Wilson wants to call back in while we're finishing, just let me know so we can flag it. Seeing that we have reached the end of public comment, I want to give the chance for my committee members if they have any comments that they want to do, since this is our last time meeting before the next legislative session. Senator Nguyen, I think you have a comment.
Yes, I just wanted, I'm probably speaking for everyone else on the committee too. I don't want to be presumptuous, but for all those people that are watching that have participated in this or have questions or concerns or want to continue to stay involved in some of the numerous bills that were recommended out of the work session, I would encourage you to continue to reach out to all the members of this committee as we're working through those and the development of the actual language that we will see hopefully proposed in the upcoming legislative session. And then on a personal note, I just want to thank our chair. He ran amazing meetings, took on some very complex topics and always kept us on track. And we had long meetings, but I think it was really important to have the voice of our community that we serve, have that input so we can make our healthcare delivery, accessibility, everything just that much better. So thank you, Chair.
Thank you so much, Senator Nguyen. Any other comments, Vice Chair Licker?
Thank you, Chair. I want to echo Senator Nguyen's comments about the chair leading us so ably. I also want to thank my colleagues and all the people who came and testified. I learned a heck of a lot this interim, and it was great to get the input and from people out in the community and from my colleagues. And I think that you helped us shape a very good agenda of recommendations. So thank you.
Thank you so much. Any other comments down south? Senator Titus.
Thank you, Mr. Chair. I just want to thank you, Chair, and all the members of the committee, but especially the Chair, to have an open-minded process and really looking at what the issues are in our state across the spectrum and addressing all of it. Although we won't, and we didn't always agree on the avenue to solutions or the pathway to solutions, we certainly had great lines of communication, open to having multiple discussions and really want to get stuff done. I've been on this interim committee many times now, and one of my frustrations is that we have these 10 BDRs. We look at these ideas and then we only get one or two passed. And so from the start, you were there looking at how open to comments, open to suggestions, but especially open to finding correct solutions that can move forward. So thank you so very much for that. And all committee members for your great comments and really trying to address the issues with healthcare in Nevada. So it was a pleasure being on this committee, and thank you all.
Thank you so much, Senator Titus. Any other comments? I know Ms. Wilson. I know Ms. Wilson had a few glitches on her, but we received a comment from her, and it sounds like it was expressing gratitude to the committee for their approval of the tribal bill draft request. And so, of course, thanks to her and to all the committee members and folks who participated in this process. It's when I first got the notification that I was going to chair this committee, I think it was a very daunting task, and I think folks, the committee members and the staff can attest that we had a very long time trying to plan each committee, and there were some that were often very, very difficult, including planning the behavioral health ones. But I want to thank of course, our colleagues and all the members that sit on this committee. I think we worked really, really hard behind the scenes to make sure that most, if not all, these bills were passed bipartisan. And I mentioned at the beginning during my opening remarks of this interim that our goal is to pass things bipartisan because we want to make sure that healthcare is improved in our state. Ultimately, it doesn't really matter what our background is. We all have to live in the same system, in the same community. And so what matters most is that we can protect our well-being and that we protect each other. And so I think while some of these bill drafts may have not gone far enough, and we're still going to have issues, of course, beyond them, I think that we worked hard behind the scenes to at least solve some issues. And so I just want to, folks, for those watching, encourage individuals to participate. The bills obviously don't go into effect tomorrow. We still have a lot of changes that we have to go through and questions that have to be asked. And some of these bills may survive, some of them may not, but hopefully we had at least some discussion as to why we wanted to arrive to these conclusions. And hopefully some of these ideas continue to move forward into the next legislative session. And I do want to take the time to thank our staff, of course, Patrick, Davis, Sarah, Eric, Kimbra, lots of folks behind the scenes that were helpful in making these bills and these committees run smoothly. And so I just want to express my gratitude to them. And of course, as I said at the beginning, now the work really begins to making sure that we improve the lives of Nevadans. So thank you all. And we will see you all in Carson City and hopefully in a matter of time. And so please enjoy the rest of your day. And thank you so much, everyone, for joining us here today. And meeting's now adjourned.
Thank you.
Thank you.